When confronting the problem of substance abuse, it makes sense to focus attention on the most dangerous types of drugs. And right now, fewer substances are more lethal than prescription opiates and heroin. Addiction to heroin and other opiates, including certain prescription painkillers, is impacting the lives of Americans in every state, in every region, and from every background and walk of life, and all too often with deadly results. Between 2006 and 2010, heroin overdose deaths increased by 45%. Scientific studies, federal, state, and local investigations, addiction treatment providers, and victims reveal that the cycle of heroin abuse commonly begins with prescription opiate abuse. The transition to and increase in heroin abuse is a sad but not unpredictable symptom of the significant increase in prescription drug abuse that we've seen over the past decade. Now, it's clear that opiate addiction is an urgent and growing public health crisis, and that's why Justice Department officials, including the DEA, and other key federal, state, and local leaders are fighting back very aggressively. Confronting this crisis will require a combination of enforcement as well as treatment. The Justice Department is committed to both. On the enforcement side, we're doing more than ever to keep illicit drugs off the streets and to bring violent traffickers to justice. With DEA as our lead agency, we have adopted a strategy to attack all levels of the supply chain to prevent pharmaceutical controlled substances from getting into the hands of non-medical users. DEA proactively investigates the diversion of controlled substances at all levels of the supply chain. This includes practitioners that illegally dispense prescriptions, pharmacists that fill those prescriptions, and distributors that send controlled substances downstream without due diligence efforts. DEA also uses its regulatory authority to review and to investigate new pharmacy applications in targeted areas to identify and to prevent storefront drug traffickers from obtaining DEA registrations. And they're also going after pill mills. Since 2011, DEA has opened more than 4,500 investigations related to heroin. They're on track to open many more. And as a result of these aggressive enforcement efforts, the amount of heroin seized along America's southwest border increased by more than 320% between 2008 and 2013. Of course, enforcement alone won't solve the problem. And that's why we are enlisting a variety of partners, including doctors, educators, community leaders, and police officials, to increase our support for education, prevention, and treatment. DEA engages in widespread education of pharmacists, doctors, and other health practitioners in the identification and prevention of controlled substance diversion during the healthcare delivery process. In the Northern District of Ohio, for example, the U.S. Attorney convened a summit at the Cleveland Clinic, bringing together health and law enforcement professionals to address that area's 400% rise in heroin-related deaths. And nationwide, the Justice Department is supporting more than 2,600 specialty courts that connect over 120,000 people convicted of drug-related offenses with the services that they need to avoid future drug use and to rejoin their communities. We can and we should be proud of these results, but more can be done. And frequently, the most effective efforts are those that begin at home. Parents and families can help raise awareness about the devastating consequences of opiate abuse. And Americans like the Gates family of Skowhegan, Maine, are showing the way. Their son Will was a bright young student at the University of Vermont who overdosed on heroin and who lost his life 5 years ago this month. During their grief, Will's parents and his brother have transformed their story of heartbreaking loss into a powerful force for change. Working with the U.S. Attorney's Office in Vermont, they created an award-winning documentary called The Opiate Effect to educate people about the realities and the dangers of opiate abuse. 50,000 people have already watched this video for free online, and I urge you to do the same. Because it's only by working together that we can confront this crisis, strengthen our communities, and save lives.